3 of the Ashton Manual goes into the symptoms of withdrawal and how to cope with these symptoms. They're listed in 3 different categories. There are the normal symptoms that are considered to be a regular part of withdrawal, and then there are the acute symptoms and the symptoms of protracted withdrawal. Protracted withdrawal refers to 10 to 15% of people that take benzodiazepines who will experience a withdrawal syndrome for months or even years post-cessation. While this list is not comprehensive, it provides us with a valuable perspective that can help in coping with benzodiazepine withdrawal and the distressing nature of these symptoms. The most important thing to keep in mind is that these symptoms are just symptoms. They're temporary and they do resolve with time, and this means that they don't necessarily need to be feared or even medically treated. Many of the withdrawal symptoms seem like they could be attributed to an onset or worsening of an anxiety disorder. But if we look at those symptoms in combination with all of the other symptoms, most of which are actually physical and cannot be attributed to anxiety, we see that this is simply a natural and normal part of withdrawal, and that these symptoms will resolve with time. Even some of the more distressing mental symptoms such as derealization, depersonalization, and psychosis don't necessarily need to be treated, particularly with antipsychotics, as these are temporary, normal, and will eventually go away. The physical symptoms of withdrawal can also be very worrisome to people. Many people will go in to get tests done only to find out that all of these tests come back negative. And even those who are diagnosed with a specific illness, such as multiple sclerosis, find that as they taper off the benzodiazepine and recover from their medication taper, the symptoms simply resolve and go away over time. While it's not necessary to treat any one specific symptom of withdrawal, there are things that can help to alleviate the person's distress and perhaps minimize some of the severity of this process. Of course, the biggest thing somebody can do to minimize the severity of withdrawal is to do a slow taper. Also, cognitive behavioral therapy was found to be very helpful. Massage therapy, acupuncture, deep breathing and muscle relaxation, and even homeopathy and yoga are helpful techniques during the withdrawal process. When it comes to diet and exercise, Professor Ashton really just urges using common sense. Moderate exercise is helpful. There's no need to follow sort of any extreme diets. A lot of people find that they develop a lot of chemical sensitivities and fear that maybe they're developing new allergies. But these do resolve with time, and so there's no need to necessarily avoid any foods. If you are a smoker, now's not the time really to quit smoking. Leave that for after you've finished your benzodiazepine taper. While it's not necessary to treat the individual symptoms of withdrawal pharmaceutically, there can be what Professor Ashton calls special situations where somebody may choose to take a medication. For instance, if somebody is feeling depressed and suicidal and chooses to take an antidepressant, she cautions that the lowest possible dose should be used. Also to not use Prozac, as this can cause more violent and suicidal behavior. She also warns people that in choosing to take an antidepressant, remember that this is a temporary fix for a temporary problem, and that it will need to be tapered, and that this can cause a withdrawal syndrome similar to benzodiazepine withdrawals. Beta blockers may be used to treat some of the more physical symptoms of withdrawal, but the advice for these is very similar to using antidepressants in that it's a temporary fix, and that the beta blocker should be used at the lowest possible dose and then slowly tapered post-benzodiazepine withdrawal. Generally, hypnotics are discouraged as many of them are very similar to benzodiazepines in nature or could be considered even more toxic than benzodiazepines, but that if hypnotics do need to be used, perhaps try a tricyclic or even an antihistamine instead. There are various medications listed as basically being ineffective in treating symptoms of withdrawal. These are medications that, while logically they seem like they may help, have actually proven to be pretty useless. Such medications are trazodone and other sedative antidepressants, Depakote and anticonvulsants, Buspar, Tegretol, Clondine, Adalat. There have been studies that have shown actually that these are very ineffective at treating the symptoms of benzodiazepine withdrawal. Even though this chapter provides cautions for adding in additional medications during withdrawal, Professor Ashton also states that it's not necessary to be fearful of every kind of medication. For instance, if somebody needs to go in for a surgical procedure and is administered a benzodiazepine for that, they don't necessarily need to be too worried. Or even if somebody's taking a painkiller, that they can usually do this without too much of a problem. It's important to remember that the process of withdrawal is nonlinear. There is a waxing and waning of symptoms, or what's called windows and waves, where the symptoms seem to abate for a while or become less severe during a window, and then during a wave where they become more severe, and it seems like the person might actually be going backwards in their progress. But remember that this is actually normal, and that these are not signs of worsening of an illness, but actually symptoms of recovery. At the end of this chapter, Professor Ashton addresses the various questions or theories people have as to why some people do become so much more ill or remain ill so much longer than other people prescribed benzodiazepines. And the conclusion she comes to is, we just don't know. This is why she pleads for there to be more research into benzodiazepines. She asks that there be more physician education about benzodiazepines and proper withdrawal. And she asks that there be made more resources available aside from benzodiazepine therapy. And finally, she asks that there be made more facilities available to people specific to benzodiazepine withdrawal, because detox centers and rapid withdrawal clinics are ill-advised and inappropriate for patients who are prescribed benzodiazepines. And that's chapter 3 of the Ashton Manual in a nutshell. Thanks for watching.